Hi, I'm Dr. Paul Fisher with Gold Coast Chiropractic, and today we're going to talk about spondylolisthesis. Now, before we get started on that, I want to talk about the difference between spondylolisthesis, spondylolysis, and spondylosis. They all sound similar, and sometimes they're even used interchangeably, which isn't the correct way to do it. They're actually very different clinical conditions that are pretty closely related. Now, what spondylolisthesis is that's when one bone actually shifts forward on another, just like this here. When you have this bone that will slide forward onto the one below it, and depending on how far it goes, that's how it's graded. Then we have spondylolysis, and that's where you actually have a crack in this posterior arch of the vertebrae, the back part here. That can be a precursor to spondylolisthesis, but you can have spondylolysis without spondylolisthesis. Here we see a normal lumbar spine, a spine with spondylolysis where you see the crack, and then spondylolisthesis where you see one vertebrae or bone shifting forward on the one below it. And then we also have spondylosis. Now, spondylosis is a different condition completely, and it's effectively degeneration or arthritis. But for the purpose of this video, we're going to talk about spondylolisthesis. Now, there's a number of different kinds of spondylolisthesis. We have congenital, and that's when, while developing, the spine doesn't form correctly, and you get bones that shift forward because we don't have the correct formation. Then you have isthmic, and that's effectively where you have a crack in the bone and that allows it to shift forward more to, or a defect is what that is called. Then you can have degenerative, and that's where over time the bone just slowly slips forward on the other. We're going to talk quite a bit about this one because that's actually what we see quite a bit in the office. Then you have traumatic. This can be from a number of low-level, smaller traumas that add up over time, or it can become from a very acute trauma like a car crash, something like that. Then we have pathological. This is a result of osteoporosis or another disease which would decrease the quality of the bone in the body. And then we also have post-surgical. We don't see those very often in the office. So who is most at risk? The first person we see who's most at risk is athletes. And typically the two biggest sports are gymnastics and cheerleading. Anything that puts a ton of posterior arch where they're really arching their low back like that, that just further creates that shift and that pressure in that bone. And then they're just doing a number of posterior, things are just shifting back and forth, and it can put a lot of stress in that low back, especially when the upper part of the back, if you've got other areas of the body that aren't moving the way that they're supposed to, that area can just carry a lot of stress. Another one with that is offensive linemen. You get them having to do a lot of blocking where you're putting just a compressive load on the spine, puts a lot of pressure in that area. The next one is genetics, and that's what we talked about where the pars interarticularis, one of the areas of the bone where it doesn't form the way that it's supposed to. It's not strong enough. Some people, unfortunately, just kind of get the short end of the stick and are more susceptible to certain conditions than others. And then the other one that we see most in the office would be age, and these are the degenerative conditions. Now, these are the people that we see that have had a very forward chest posture, and what happens with that is they get a very big, deep curve in their low back, and that puts a significant amount of stress where that bone just slowly over time shifts forward. When I say slowly over time, this can be years and sometimes even decades. Now, because this is such a chronic and low process, sometimes we see these patients when that has shifted quite a ways and our options are limited. If we get them early enough, these patients will typically respond very, very well to chiropractic care. And the research is showing is that if we get them before that even happens, we can make sure that we can correct that postural abnormality. So ideally, it doesn't. And now how we talk about how far it shifted, that's the grading. If the bone is shifted, if they're lined up perfectly, that's a grade 0. When it goes between, when one shifted 0 to 25%, that's called a level 1. When it's shifted 25 to 50%, that's a level 2. 50 to 75, level 3. 75 to 100%, that's a 4. And then it can actually shift all the way off the lower bone. We don't obviously see very many of those in office, and typically those are a surgical referral. Now, the symptoms that we see in this are muscle spasms, especially in the hamstrings, which when you think about it, makes a lot of sense. When you shift that pelvis forward and it goes, your hamstrings have to hold on for dear life to keep you from falling forward. And we see this not only with patients with spondylolisthesis, but also with that same posture. This is the person who, I've got tight hamstrings, I stretch and stretch and stretch, they'll go for a day and then they go back. It's because the problem isn't with the hamstrings, it's with being shifted too far forward. Now, obviously, it's important to get that shift back for our spondylolisthesis patients, but also for our other patients with those spinal abnormalities. Now, other complaints that we see with these patients are back stiffness. Those muscles are spasming on, holding on for dear life to try to prevent that shift from going any far forward. Another one is standing or walking for long periods of time, which again becomes something of a game in physics with that far shifted forward. There's only so much that those muscles can do. A lot of these patients too will talk about how if they're able to push a grocery cart or push something, that makes a significant amount of difference. And then also because that shift can affect the nerves that come out through there, we'll get pressure on the nerves. We can get weakness, numbness, tingling in the feet, a number of other issues similar to that. On our next visit, we'll talk about what we do for a physical exam in the office, and then we'll also talk about what our treatment is for spondylolisthesis. Again, I'm Dr. Paul Fisher with Gold Coast Chiropractic. Thanks, and have a nice day.